We are seeing progress. The African Medicines Regulatory Harmonization, which was established in 2009, according to Margaret, who's leading that initiative, within 6 months, we could see an African Medicines Agency in operation, that treaty being ratified by the number of countries that is needed to bring it into effect. And so we are seeing a number of regulatory authorities, Ghana FDA and TFDA, Tanzanian FDA, acquiring higher level of maturity as regulatory agency. So how much of a game changer do you see those developments, the coming into effect of the African Medicines Agency, maturity of regulatory agencies? How much will it be a game changer towards establishing a viable manufacturing capacity for vaccines and pharmaceuticals?
These are major developments. You missed one thing, and that is the Africa trade. What do you call it?
Yes, Africa Continental Free Trade Area.
At the end of the day,
yes,
there are three things in play here. One is the quality of the medicines, right? The other is registration of things. When we started out, we register in Ghana, you get that first, then we had to start registering in every other country in West Africa, because we set up originally naively, I guess, living here in the US, and you read these things, you think that they're just about to happen, right? Yeah, they said, oh, ECOWAS free trade and so on and so forth. And so naively we thought, I am from Nigeria, and naturally you would expect that I would want to build this facility in Nigeria. But, we looked at it and said, oh, Ghana seems to be a lot more welcoming. My husband is from there. It looks like it's easier to set it up there. But it would be so easy to just sell to Nigeria and to other places. Well, it doesn't work that way, because you now have to go through all the different registrations. Our investors, private equity partners, got frustrated, I told you, by the second year of coming in, and they said, stop everything. We don't want you registering anywhere. We want you to focus on the Ghanaian market. Big mistake, but that was what they thought. So two things there, the market, we've got the quality with the AMA, we've got the regulatory harmonization, which allows you to now put in just one dossier, and that region, they look at it, and you can now apply for marketing authorization in an entire region. Then the African trade, what do they call it now? I can't remember what it's called. But you now have an expanded market size.
Yes.
And that is what really matters. It is, how can I sell? How can I make the money? You can't build high quality thing like Ray in Ghana and say that you're only serving the Ghanaian market. It doesn't make any sense. That was never our intent. Never was. And so without that, those three items, they are all part of that stool, for three-legged stool for the manufacturer. One, you've got a strong regulatory. What does that do? A strong regulatory authority trying to get all the regulations. You now see that what happened in India when in the early 2000s, they decided to start closing down all the manufacturers that didn't meet a certain quality, right? Yes. Everybody has to start setting up and upgrading their facilities and so on and so forth. Because if you look at us at the time, who were to come out and make a capsule of azithromycin, our cost for making it is 20, 50 times more than our neighbor down the road, who does not have air handling units, does not have a chiller, does not have to carry all those high electricity burden and so on. You put down what our cost is significantly more. And then you want me you've manufactured at this high cost because of the high cost of utilities and so on. And if you don't have the volumes and so on, you're coming out at a higher cost out of the door. And you have to compete with the person next door who just has louvered windows somewhere, does not have any kind of quality. Yes. You have to equalize it. You've got to get Weed out all the companies that do not meet those standards,
Yes.
so that there's a level playing field. Because what
Yes.
is happening right now is that there isn't a level playing field. So all those things are very, very important. They are major, major developments I see. I have been following the AMA and the AMRH very closely. When I was at USAID, I kept talking about it and I kept trying to encourage them to support and so on, which has been done. But these are very important developments, and it is something that manufacturers had been asking for, at least a number of them. So it's good news. It's wonderful news, I think.
Excellent. I think even beyond making sure that the medicines that are coming onto those markets are of good quality, they work as they should. The other thing I think that is also important, just to add to your excellent arguments, is that at this time when African countries are trying to attract technology partners, those things really do make a big difference. How well equipped the regulatory agencies are for partners who may wish to work with manufacturers on the African continent, the Johnson and Johnson's versus Aspen type partnerships. So that's quite critical.